question has to do with understanding the nature of one's illness and how to contextualize that, especially in light of what we are exposed to, again, from information coming at us from various sources. Yeah, I think specifically with what you were referencing in that particular patient, the issue that's sort of highlighted there is that we're talking about 130 different kinds of diseases here. Now, granted, there's some similarities in behavior for several of those, but you really have to know what you're dealing with before you can start getting into making much of a prognosis. So, and for example, some people with low-grade oligodendrogliomas in the right location, once they have the tumor out and may or may not get some additional treatment past that, those people can have a completely normal lifespan and completely normal activities and be, in fact, they can have a life where no one ever knows that they had a brain tumor. There's a lot of people walking around like that now. And that's great. I mean, that's what we're shooting for. We want that for everybody, including the ones now that historically would not survive the disease. So that's that's where we're all heading, is getting to the point where everybody lives this, and it's sort of like having a sore throat, Well, I had strep throat last year, and I had a glioblastoma, and whatever. I had a skinned nose, and they were all the same thing. They just were sort of a thing. I got this medicine from my family practitioner. I mean, that's where we want to go with this. Our job is to put ourselves out of business. I'm serious. I can find a lot other things to do than I'd rather do than sit around and have people, not survive these diseases in front of me. So there's a lot more fun things to do than to not cure these illnesses. So getting to that point is where we need to go. And I think people have to approach it with that in mind. We're going to try or do our best. If they have a disease that is not a terminal illness, if it's a minor, low-grade tumor, they have to understand that. They have to get on with their lives and have goals, set goals, have things to do. They want to see that kid graduate from high school or college. They want to see a grandchild born. They want to, go get a degree in art history or whatever it is. People need to be doing those things if they can. And that's where we need to try to get everybody. So understand that the diseases are different, that different tumors behave differently, and even if you have a bad diagnosis like glioblastoma, there are patients who survive that disease, just not enough of them. I have 30-year survivors.